I've been having some pain with my throat. It's been very sore and it's been really uncomfortable. I haven't been able to sleep well at night. I haven't been getting a lot of sleep at all because it's just kind of been plaguing me. So I'd like to get some relief for it. Yeah, it kind of hurts.
Okay. On a scale of 1 to 10, how intense is the pain?
It's about an 8.
8. And when did these symptoms begin for you, Alessandra?
They began about 4 days ago.
Okay. Is anybody in your household sick? Have you been exposed to anybody that had any symptoms?
I'm not sure where I got it. No, no one in my house is sick.
Okay. This holiday season, do you want to smell great at a discount? Then check out Dossier. Shop up to 50% off with our Dossier discount code. Click in the link in the description down below to get your amazing designer-grade perfumes at a discount today. Dossier is the absolute most perfect holiday gift this season. You will get incredible fragrances that are just as good as designer-grade, but at a huge discount. With Dossier, you can own high-quality scents without spending hundreds of dollars. You can even order up to 9 scents at once, making it easy to find your new signature fragrance. Dossier sent me their ambery saffron and an absolute favorite of mine that I had to order a couple of times because I'm just running out of it. Gourmand White Flowers. Ambery saffron, inspired by MFK's Baccarat Rouge 540, which retails for $465. With notes that linger all day, the saffron and orange blossom scents will steal your heart. Dossier only charges $44 right now, a fraction of the cost for the same exact smell. Just look at the quantity, 50 milliliters in each bottle, filled all the way to the top. Magnetic top is just an amazing perfume. I also got the Ambery Vanilla, another favorite of mine. Ambery Vanilla, inspired by YSL's Black Opium, which costs $130. This is the ultimate confidence boost smell. Why not get it from Dossier for only $26? The exact same smell, a fraction of the price. You must check out the Gourmand Orange Blossom scent. It's divine. Gourmand Orange Blossom perfume, inspired by Lancome's La Vie est Belle, which retails for $118. This is a true head-turning feminine fragrance that starts as a floral trio of jasmine, orange blossom, and orris, blended with a fizzy touch of blackcurrant and hazelnut. You will make an impression while wearing this perfume. It comes beautifully packaged, so it makes for the perfect gift this holiday season. Does it hurt you when you swallow?
Yes, definitely. I tried taking some over-the-counter medicine. I took Tylenol, but it still isn't helping it like I would hope it would be.
Okay. When is the last time you took a Tylenol dose?
I took it about 4 hours ago.
And can you describe a little more the sensation that you feel in your neck?
Yes, so it feels very scratchy, and when I swallow, I can feel, it feels like a big lump, and when I drink cold water, it's kind of unbearable, so I've been trying to stick to drinking tea and drinking hot water because the cold water just is very uncomfortable.
Okay. Do you have trouble speaking sometimes?
Oh, yes.
Okay. I'm not seeing any obvious signs of any swelling, but we're gonna have to do a more in-depth examination to figure out if you have maybe a viral or bacterial infection or something related to the skin. Okay. Do you feel any numbness or any tingling sensations anywhere in your body?
Yes, I do feel tingling. Not so much numbness, but I do feel the tingling.
Okay. Can you point to where you feel that sensation?
Probably on the sides.
Okay. Got it. How about the midline of the throat?
The midline is more soreness. The tingling is mostly to the sides.
Okay, so right here we have pain and tingling on the side. Okay. Going to go ahead and put my gloves on. May I have your index finger, please? Good. This can rest right here. So go ahead and relax. I'm going to listen to your heart. Just breathe normally. Good. So I'm hearing normal rhythmic activity. Going to listen with the bell side as well. Good. Now let's take a deep breath in and check the lungs and out. Deep breath in and out. Good. Good. Now you can breathe normally. I'm also going to check the base of the lungs. Good. So I'm not hearing any signs of bronchitis, no adventitious sounds, so the lungs are clear, which is a very good sign. Okay, oxygenation is good as well. Good heart rate. I'm going to take a note of this. How's the throat feeling? A little better?
It's already done a little better.
Good. Okay. So 99% oxygenation. 75 beats per minute. Are you an athlete? Do you do any regular sports or exercise?
I go walking a lot, but nothing too strenuous.
Okay, and lungs and heart. S1 and S2 not present. Okay, good. Are you allergic to any medication?
I am allergic to amoxicillin.
Okay. So if I need to prescribe any antibiotics, then I'll stay away from that. Prescribe you some other broader spectrum other than amoxicillin. Okay, good. I'm gonna check your temperature as well. Okay, good. 98.3, but yeah, any fever would be masked by the ibuprofen. So we can't really rely on that. Now go ahead and check your temperature, your blood pressure. So this is going to go right arm over your artery, so like that. Good. Can just rest it. Good. Okay. Good news is that the blood pressure is also within normal range. One 120/65. Okay, very good. Right. Next up, I'm just going to observe your skin and your neck and see if I see any visible signs of anything that might be a condition related to your skin. Okay. All right. And then we'll take a look inside your throat. I'm noticing a little bit of a swellness over here on your right side. A little bit of redness too, right above your right clavicle. Okay, let me go ahead and palpate. Go ahead and close your eyes. I'm checking for symmetry. The right side is definitely more indented. Going to check your lymph node. Okay. Your submandibular lymph node is a little inflamed, which may indicate response to a viral infection. Going to check the supraclavicular lymph node. They're not enlarged. And the axillary lymph node. As well as the pectoral line. No, not enlarged. Good. Okay. Okay. So I'm going to make a note of the fact that your submandibular was enlarged. Occipital, pectoral, axillary, we're okay. Okay. Right. Next up, I'm going to just use my medical hammer to tap on your body to check for basic neurological responses. So go ahead and relax. I'm going to start at the top of the head. Good. Good. If you can leave your arm loose to the side. Yep, give me all the weight. Good. Same on this side. Good. Good eye reflex there. Good. If you can open your mouth a little bit. Good. You can close it now. Right, let's take a look in the back of your throat. see. Yep, definitely red. And I can see some pouches of white dots, which may be consistent with strep throat. So I'm going to be suspecting a bacterial infection as of right now. I want to take a closer look at this patch of redness here. Do you usually wear any necklaces or anything around your neck?
Occasionally.
Maybe some contact dermatitis. Let me just look. Going to apply some solution so that I can take a sample of the outer layer of dermatitis. The reaction has begun. Going to go ahead and let the catalyst activate the skin. And I'll take one sample. I'm gonna send this to the lab and see if we're dealing with just pure contact dermatitis or anything else more troublesome that we may need to treat with medication. Go ahead and also check your eyes and your ears. Have you had any trouble hearing or seeing?
No, I have not.
No. Okay. Good. Just good. There you go. All right. I'm just going to take a look inside the ears first. This is part of just the annual regular checkup. And if there's any bacterial or viral infection, it may also affect the ears. Good. Okay, you can look over to your left. Okay. No discharge. heart, normal tympanic membrane, pearly gray color. All the bony landmarks are present. Good. Good. No signs of any infection. Any trouble seeing? Blurred vision, double vision? No. Good. Okay. Can look into the distance for me. Keep your eyes open. Just gonna try to. There you go. Okay. Okay, optic disc and optic nerve are intact. Ears and eyes are okay. Okay. Okay, Sandra, I'm going to take a look at your tummy. Is it okay if I unbutton your skirt? Okay, let's tuck that in. Okay, first going to do just a visual inspection. With my UV light. Taking a look at your belly button, which looks normal, no signs of any infection. Okay. And under regular light. Okay. No redness, no signs of any allergic reactions of the skin, no contact dermatitis. Okay, good. I'm gonna go ahead and just palpate. Check for any masses, lumps, bumps. Starting off with the light palpation. And a slightly deeper one around the tip of your liver. Which is not enlarged. Okay, good. Now I'm go ahead and do a sensitivity test on your tummy as well. So go ahead and let me know if you feel a sharp or a dull object.
Sure. Dull. Dull. Sure. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp.
Very good. I'm also going to auscultate your abdomen. So go ahead and just breathe normally. Going to listen to the 4 quadrants. Normal abdominal cavity sounds are heard. No swooshing sounds or anything concerning. Okay. I'm also going to check the maxillary sinuses. The frontal, sphenoid and ethnoid. Okay. Not feeling anything abnormal. checking the top of your head for any masses and symmetry. Okay, I'm going to examine your scalp next. Checking for the strength of the hair strand. Not noting any breakages, which is good. Okay. Checking the hairline. And the eyebrows, which are symmetric and no hair loss noted. So no indication of hypothyroidism. Okay, can you tilt your head towards your left side? So this is where we were noting the inflammation earlier. Checking behind the ear. No irritation of the skin, no redness, and no reaction to contact. I'm going to do a series of tests on your face and neck to check for neurological responses that may indicate anything abnormal. And I'm going to start with a sharp object that has two prongs, and I'm going to touch you with either both of them or only one. So I want you to say one or two. Okay, let's begin. 1, 2, 2, yes, 2, yes, 1, yes, 2, yes, 1, yes, 1, 1, 2, 1, 1, 1, 2, 1, 2, 1. Okay. Now let's focus on the area here that we noted the inflammation. 1, 1, 2,
One. One. Two. 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 One. Two. One.
Okay. And now I want you to tell me which side of the face I'm touching you, left or right?
Right. Left. Right. Left. Right. Left. Left. Right. Right.
Okay. Next up, I'm going to touch you with either a wet or a dry object. So I want you to say wet or dry.
Wet. Dry. Wet. Dry. 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 Wet. Dry. Wet. 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 Dry.
Okay. And next up, I'm going to touch you either with a sharp or a dull object.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. And next up, I'm going to use a slightly sharper object.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Good. Now let's focus on your neck.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. Next up, I want you to count how many times you feel me touching you.
Once. Twice. Three times. Four. Five. Three. twice, twice, once, 3.
Okay. Do you feel this equally on both sides of your forehead?
Yes.
Okay. Equally on both sides of your cheeks?
Yes.
Okay. Equally on both sides of your jawline?
Yes.
Equally on both sides of your chest?
Yes.
And do you feel me touching you on both of your shoulders?
Yes.
Okay, good. Alright, let's take a look at the scalp next. Looking for folliculitis, dermatitis, and I'm not seeing any indications of any contact dermatitis or ringworm or anything out of the ordinary. I'm gonna go ahead and create part of the hair in the middle. And inspect the skin.
Two. Two. 1, 2. 1, 2. 2. 1. Okay.
Okay. Scalp looks healthy. Alright, let's take a look at your legs and your feet. Just going to do a visual inspection first. Checking for any edema, signs, redness, swelling. checking in between the toes. You have a little bit of the skin here peeling off of your toe on your left foot. Does this bother you? Any pain?
No.
Okay, can you wiggle your toes for me? Okay. I'm gonna take a closer look at that piece of the skin there that's peeling off. Okay. Nothing to be concerned of. You may just need to apply a little more hydration. Okay. I'm going to palpate your feet and legs. Can you push into my palms? Good. Now I'm going to attempt to raise your legs. Don't let me do that. Good. And I'm going to attempt to spread them apart. Don't let me do that. Perfect. And now can you point your toes towards your head? And now towards me. Now towards your head again. Good. Okay, plantar region looks healthy. I'm going to do the Babinski test. So let your foot loose. Okay, perfect. Then this one. Good. All right. So now we're going to do some sensitivity tests as well. I'm going to touch you with an object and I want you to tell me when you stop feeling it.
Now. 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 Now.
Good. Now can you move the toe where I'm touching you? Okay. And can you tell me which toe I'm touching you on now?
My right toe.
Okay. And how about now?
Right foot.
Right foot, okay. You can just tell me right foot or left foot.
Good. Left foot. Right foot. Left foot.
Okay, very good. And now, am I touching you with one object or two?
One. One. Two. Two. One. One. Two. Two. One. Two.
Good. Okay. No, you can stand up now. We'll discuss the results. Okay, Alessandra, so I did a very thorough investigation of everything. You did confuse a little bit some of the sensations, so not all of the sensory tests were a pass. So I'd like to focus a little more on that with you in this position. So I'm going to go ahead and touch you with something either sharp, so it's going to feel like this, or dull. It's going to feel like this. So keep your eyes closed and tell me if you feel sharp or dull.
Sure. Dull.
Okay, so the chest area is okay. Let's try the arms now.
Sure. Dull. Sure. Dull. Sure. Sure. Dull. Sure. Sure. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Wait, sharp. Dull. Sharp. Dull.
Wet or cold?
Wet. Cold. Wet. Wet. Cold. Wet. Cold. Wet. 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 Cold. Wet. Wet. Cold. Wet. 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 Cold. Wet. Cold. Wet. Cold. Cold. Wet. 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 Cold.
Okay, and I want you to tell me if you feel this equally on both of your legs. So that's one. Are these two sensations similar?
Yes.
Okay. How about these two?
Yes. Yes.
Okay, good. Okay, Alessandra, this concludes the examination for today. The cold and wet tests were a little problematic for you, as well as the sharp test. I'm just gonna make a note of that. I think all we need to do is treat you for the strep infection. So I'm going to prescribe a course of broad spectrum antibiotics other than amoxicillin. I want you to take that for 12 days. And I see that we have your pharmacy on file here, so I'm just going to send that over right now. And let's see how you respond to the antibiotics. And I want you to come back and see me in 3 weeks.
Okay, thank you.
Hi, Anastasia.
Hi.
Good to see you again. How
You
are
too.
you?
I'm good. How are you?
All good. My name is Dr. Lux, and I'll be doing your checkup today. So tell me what brings you in.
So I was on a ski trip a couple weeks ago in Colorado, and ever since then I've been having some issues with my skin.
Okay.
I was out in the cold for a little too long some of the days, and I didn't have gloves on. I usually do, but I didn't this time, and I noticed, like, I don't know if it's frostbite or something started happening in my hands and my face.
Okay. Yeah, I do see some redness. And you mentioned this happened 2 weeks ago.
Yes.
2 weeks ago. On your faces. And what are the sensations that you're feeling right now?
So my hands, my face, and my feet, they've been kind of numb since then.
Numbness.
Sometimes even when I touch my neck with my hands, I can't even feel the sensation. I've been noticing some redness on my hands and my face, especially after I get out of the shower. They've been very dry as well.
Okay. Other than numbness and redness, have you noticed any other tingling sensations or abnormal feelings or?
Yeah, mainly on my feet and my hands, sometimes on my face a little bit as well. And I've been having a headache as well since that.
Okay.
The last couple of days that I've been there.
So the headache started 2 weeks ago at the same time?
Yeah, the same time. It was when I noticed I was out in the cold for too long. It started at the same time.
On a scale of 1 to 10, how intense is the headache?
It's not too bad, maybe like a 4, but it just feels like it's never going away. It's almost always there. It's been very annoying.
Can you point to where in your?
It's mainly in the front of my head, but also my ears have been hurting, and the surrounding area behind my ears, around them, I've been in pain as well.
So frontal cranial area and ears. Have you noticed any discharge from your ears? Any wetness or abnormal?
A little bit of wetness that day and the day after, maybe for like a couple days actually, but that went away. But the pain is still there.
Any abnormal sound?
No, I mean, sometimes I have ringing in my ears, but that's already been an issue even before. But it's not too bad.
Okay. Any blurred vision or double vision, especially when you get the headache?
Sometimes a little bit when I get the headache, but not every time. That day, though, I was having a bit of blurry vision and my eyes were very dry, but it hasn't been too bad since then. I've been using some eye drops.
And do you happen to remember the outside temperature during those 2 weeks while you were?
It was like negative 25 to 30 Celsius most of the days.
So that's very cold. That's extreme cold. And you mentioned you were not wearing gloves.
And I was for most of the time, but then a couple of days when I got the frostbite, I lost them. So the last couple of days I wasn't wearing them.
How about the hat? Was your head completely exposed to the cold?
I had a hat on, but I guess it wasn't very thick.
And you also mentioned that your feet are impacted. How about your legs?
I think up until my knee, sometimes they get a little bit tingly and numb, but that's just sometimes like after a shower or after working out.
Okay. So feet and legs up to the knee area. Okay. Have you taken any medication or anything for the headache?
Sometimes I do take an Advil for my headache, but I try not to.
Has that helped?
It does. It doesn't make it go away completely, but it helps.
Does the pain wake you up at night?
Yes, and it's hard to fall asleep from it as well. I think it's worse in the morning, actually, is when it's at its worst.
Are you on any other medication?
No. I mean, I take vitamins and supplements, but no prescribed medication.
Just over the counter.
Yeah.
And how are your energy levels?
They have actually been pretty low ever since those last couple days of the trip. I was there for a week.
Any other pain anywhere else in your body? Your back, your joint?
Well, sometimes my joints have this, like, sensation that they're really cold ever since that day. They're not in a whole lot of pain, and this doesn't happen every day, but it's like my bones are cold or something.
Have you heard any cracking sounds, any weird popping sounds when you just use your hands or your...
Oh, my hands, yes, but everywhere else it's okay, like not more than usual.
Have you had any difficulty breathing, feeling like you're, gasping for air or you can't catch your breath?
Actually, now that I think about it, when I work out, I've been at a loss for breath more than usual lately.
Right, so what I'm going to do today for you is a complete full body examination to make sure that I check out your skin and that neurologically, we're not dealing with something more than just skin exposure to cold. So I'm going to go ahead and do that today. Do you have any other concerns that I should know about?
Everything's been mostly fine, besides all those other things.
Okay, sounds good. So I'm going to go ahead and put my gloves. And I'll start by taking the vital signs to make sure that we have a good baseline.
Thank you.
And do you have a headache right now?
Yeah, but it's like around a 3 right now. It was really bad this morning, actually, but I took an Advil before I came here.
Good. So let's go ahead and just check your temperature. Have you had any flu-like symptoms in the last couple of days?
No, just besides the low energy, not really.
Okay, so no runny nose, no sneezing. Let's go ahead and place this under your tongue, and you can just hold it. I'm also going to check your level of oxygenation and your heart rate through the index finger. So let's go ahead and rest that. Okay. 97.9, so normal temperature. I'm reading 99% oxygenation and 60 beats per minute, so your heart is very relaxed. And I can tell that you're working out because you have a very low resting heart rate, so that's very good. So normal temperature and oxygenation within normal limits at room temperature, good heart rate. And I'm going to go ahead and listen to your heart and your lungs. Go ahead and breathe normally. Go ahead and take a deep breath in and out. Deep breath in and out. Okay, good. You can just breathe normally. Switching to the bell side as well for the more superficial sounds. I'm hearing S1 and S2 with no extra hard sound. That's wonderful. So lungs were clear. You did not catch any pneumonia or anything more complicated.
Okay.
I was not able to hear any adventitious sounds or any wheezing in the lungs. So that's very good. And the heart sounds were normal as well. Okay, I'm gonna go ahead and check your blood pressure as well. Have you ever been diagnosed with low, high blood pressure before?
No.
Okay. Is it okay if we use this hand?
Yeah, of course.
Okay, so then we go ahead and match the artery right here. And you can just rest your hand and the legs are uncrossed. Good. Okay. So blood pressure is a little bit on the low side. Are you feeling dizzy by any chance now?
I wouldn't say dizzy, but I am a little bit lightheaded.
Okay. I am 110/65. I would recommend that you increase a little bit your salt intake. Do you usually use salt in your diet?
I actually only started doing that a couple days ago.
Okay.
Because I read that I think I might be lacking some based on some of my symptoms, but I haven't been eating a whole lot of salt my whole life.
Yeah, and also sea salt. That would be very good to include in your diet so that you get all of the minerals, not just the sodium, iodine-based table salt, but also sea salt that has more minerals might help
Okay.
increase that blood pressure a little bit.
Okay, thank you. I'll do that.
Okay. So I'm gonna go ahead and just inspect your appearance right now. And I'll be checking for anything abnormal on your skin, any redness. I can already tell that there are some spots that are a little bit red. Especially on your neck, over on the left side. Okay. The right cheek is a little bit redder than the left one, and same pattern is maintained on the neck as well, going to the chest, but the difference is not very big, so I'm not too concerned. Okay, I'll be looking at the inside of your arm as well. Good. Paying particular attention to any colors that are on the blue-purple spectrum, which I'm not seeing. The numbness is a little bit concerning, especially when there are no physical signs of intense frostbite. So do you feel this equally on both sides of the forehead?
I feel it a little bit more on my right side.
And do you feel this equally on both sides of the cheeks?
A little bit more equal there, but the right side is worse, especially closer to the ear.
And how about this?
It actually feels pretty okay there.
And this?
The same thing, the right side is more sensitive. And the same thing there as well.
Okay. I'm gonna go ahead and palpate your head. Check for any lumps, bumps. Any pain when I apply pressure?
Yeah, especially in the front.
Okay, on a scale of 1 to 10.
That was like a 6, 7, something like that.
How about when I apply pressure laterally? Any pain there?
It's more like a 2, 3, especially on the right side.
How about when I apply pressure
Oh,
on
it's actually really bad there. Like
the ears
an 8,
around?
yeah, 8.5.
I am sensing an inflammation over on the right side here. So the mastoid bone process is definitely impacted. Could be an infection. It could be a reaction to the cold. So let's go ahead and check your ears. First, I'm going to do a hearing test. So I have here a tuning fork, and I'm going to strike it and cause a vibration. And I will place it near your ear in 2 positions. And I want you to tell me which one is louder.
Okay.
So that's position 1. And position 2. Which one is louder?
1.
1? Okay, good. And now I want you to tell me when you stop hearing a sound.
Okay. No.
Good. Okay, now we're going to do the same thing on this side. That's position 1, position 2.
I kind of hear them both the same in that area.
Okay. And now tell me when you stop hearing a sound.
No.
Good. Okay. And now I'm going to strike the tuning fork again and place it on various parts of your body. And I want you to keep your eyes closed and just say yes when you feel it.
Okay.
I'm trying to detect how well you can sense the touch.
Yes.
Good.
Yes. Yes.
Good.
Yes. Yes. Yes.
Good.
Yes. Yes.
Good. And now can you feel this?
Yes.
Good. And this?
Yes.
This.
Yes.
All right. So let's go ahead and look inside the ear. And I'll be taking a peek inside your ear canal. And I want to see if I can spot any infection or any abnormal discharge, anything that would require us to put you on antibiotics.
Okay. Sounds good. Thank you.
You can look over to your left. I'm going to go ahead and just slide this inside the ear canal. Okay. I'm able to visualize the ear canal. I see the tympanic membrane, pearly gray color, a little bit of a discharge. And if I just go a little deeper, oh, yeah, I can definitely spot an infection. And I can see why your mastoid bone process is so inflamed. Yeah. Yeah, definitely I can tell that you have an ear infection going on, and the whole inner part of the ear canal has a lot of wetness and a lot of discharge. So I'm gonna go ahead and make a note of that. And we can definitely put you on antibiotics.
Thank you.
I'm going to prescribe 750 milligrams of amoxicillin that I want you to take twice a day, so once every 12 hours
Okay.
for 7 days. Okay. And let's go ahead and look in the other ear as well, just to compare, and so that I have a good baseline for the other ear. Pearly gray tympanic membrane. Bony landmarks are present. Whitish filament, well-defined margins, and no discharge. Good. This ear is clean. Okay, so that concludes the ear exam. We'll put you on antibiotics and clear that infection right out. I'm gonna go ahead and focus on your eyes. And first I'm going to check with the light. So I want you to look into the distance, and I'm gonna check for the pupil reflex. Good. 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 And I want you to look at me now, right here. Perfect. So no concerns with your eyes. Next up, I'm going to check your cranial nerves to make sure that neurologically everything is okay. So I'm going to push on you. I want you to kind of resist my push. I want to check how strong your back muscles and just your overall spine is.
Okay.
Okay, good, perfect. Now I want you to squeeze my hand. Good, perfect. And now I want you to keep your head steady and to just follow my fingers with your eyes on. Okay, good. 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 Perfect. Okay. I'm also going to take a peek inside your optic nerve and optic disc and just make sure everything checks out over there.
Okay.
So go ahead and look into the distance for me. Going to get a clear picture of your eye first and calibrate my device. Perfect. Then I'm going to get really close and check the optic nerve and optic disc. Good. Now look into my ophthalmoscope device. Perfect. Good. Now I'm going to do the same in the other eye. Look up for me, down, and now into my device. Perfect. So, eye exam is all good, no abnormal findings, good ratio on the optic nerve, no shadows, no scratches on the retina, and good mobility. So cranial nerves 4, 5, and 6 are okay. Can you move your head left to right for me? Any pain when you do that?
Yeah, when I moved my head to the right just now, I felt it like here. Some tingling.
Okay, I'm gonna do a neck inspection in a moment after I'm going to ask you to lay down.
Okay.
Okay. But before we do that, I am going to check your skin a little bit more.
Okay.
So I'm going to ask you to close your eyes and I'm going to touch you with something that feels just very soft. And I want you to tell me if you feel it on your left side or your right side of the body.
Left. Right.
Okay, good.
Left. Right. Left.
Good.
Left. Right. Left. Left. Right.
Next up, I'm going to give you something to taste. And we're going to make sure that cranial nerves are intact and that your sense of taste is not impaired.
Okay.
Go ahead and just, yep, and now close your mouth and open. Good. What does that taste like?
Like raspberry.
Good, perfect. So you're able to taste just fine. And I'm also going to give you something to smell. With both of your nostrils unobstructed. distributed?
No, it's like orange.
Good, perfect. And now I'm going to ask you to close one of your nostrils.
Okay.
And I'm gonna smell this as well.
It's very chocolatey.
Perfect. So cranial nerves that control the sense of taste, touch, and smell are intact. Wonderful. I'd like you to lay down now so that I can take a look at your neck a little more and palpate, make sure that the lymph nodes are all okay, and then I'll check your abdomen, your legs, and your feet.
Okay, sounds good. Thank you.
Okay, I'm gonna go ahead and palpate your lymph nodes. And you can just close your eyes and relax. Gonna make sure that I'm not missing any inflammation signs that may have to do with how the fluid drains in your body. Okay, so I'm checking the pre-auricular and posterior auricular lymph nodes around your ear. And now the tonsillar lymph nodes and the submental. Good. Cervical. And we're on the right side, where I was able to notice most of the redness. This is where the mastoid bone process inflammation is also happening. Gonna go ahead and try to feel for any indentation in your skin. There is an overall inflammation. But it seems to be evenly distributed. With no micro indentations. Good. Going to check your sinuses as well. And I'll be gently tapping on your face. Let me know if you feel any pain.
No pain. A bit of pain there. And a little bit of pain there as well. And there too. Yeah, it's actually really bad there. It's a little less, but still there. also some pain. It's getting less the further you go back. A little bit there. There too.
So it's mostly localized in the front area of the ear. Let's try to tap in the back of the ear as well.
Oh, it's really bad there.
Okay.
There too. There also. Not so bad there. My skin just feels a little weird there, but it's not too bad.
Do you feel this?
No.
How about this?
I felt a little bit, yeah.
Interesting. Do you feel that?
Yeah. Very light. I felt it closer to the top of my neck. There, I felt it, yeah. I felt it there too. I felt that also. And there. There too. I felt it there too. And that too.
Okay, do you feel this?
Mm-hmm.
And that?
Mm-mm.
How about this?
No.
And this?
No.
This?
Mm-mm. Yeah, I felt that. That too. Felt that. Felt that too. Felt that too. And that.
Okay. So you do have some loss of sensation, but it feels pretty just irregular. There's no obvious pattern, and it's spread out on the right side of the neck in just patches. So this could be because of frostbite. Do you feel this?
No, I heard it, but didn't feel it. I felt that, yeah.
Okay.
Didn't feel that.
Mm.
Didn't feel that either. Felt that.
Okay. So definitely the neck is affected. I'm gonna do just a deeper palpation in the neck. Supraclavicular lymph nodes are not enlarged. I'm looking for any masses or any indentations that are in the deeper parts of the skin. Nothing other than the inflammation here in the mastoid bone process. Okay, let's take a look at the abdomen next. Okay, Anastasia, I'm going to take a look at the abdomen. Is it okay if I lift your top just slightly? And then is it okay if I expose your belly button?
Yeah, of course.
I'll be doing a visual inspection first. It's part of the routine checkup just to make sure we're not missing any physical signs. So, standard basic clinical exam. Good. I'm going to go ahead and listen to your abdomen. So just breathe normally. Good. I'm hearing activity in all 4 quadrants. Some gurgling, which is within the normal range of activity in the abdominal area. Switching to the bell side for the superficial sounds. And again, rechecking the 4 quadrants. Good. I'm not hearing any signs of obstruction. I'm going to go ahead and feel the pulse, and that is in between the 5th and the 6th intercostal spaces. That's the pulse of maximum, the point of maximum impulse. 2, 3, 4. Good. So that's normal. I'm gonna go ahead and palpate your abdominal area. Checking for any hidden masses or abnormal enlargement of your internal organs. Checking the stomach. Good. Normal size. And the liver. Can you lift your leg slightly so that there's no tension in the muscle, and take a deep breath. And now exhale. Good. You can lower your leg now. The tip of the liver was barely palpable, and now I'm going to press down on your kidneys. Good. You have strong abdominal muscles. All right, perfect. I'm going to go ahead and take a couple of measurements. That's 30. Checking the overall proportions of your body. Perfect. Okay. Next up, I'm going to check the skin on your abdomen, and I'll start off by just making sure there are no indentations or bumps inside the skin.
Okay.
So go ahead and relax. Nothing hidden underneath the skin. Okay. Are you able to feel this?
Mm-hmm.
Good. And now, can you tell me if you feel me touching you on the right side of your body or the left?
Okay. Right. Left. Right. Left. Left.
And how about now?
Right. Left. Right.
Perfect. Now I'll just be doing some tapping and percussion to make sure that the resonant sounds are okay too. Good. Good. Nice and bass. Bass sounds are good. Similar resonance throughout the abdominal cavities. That's all quite normal. Okay, I'm gonna go ahead and check your legs next.
Thank you.
Okay, I'm gonna go ahead and take a look at your legs next. And I'll be doing just a visual inspection first. And trying to make sure there are no signs of frostbite. You have one bruise on your right leg. It looks a little bit bluish. Does it hurt?
Not anymore. That's from when I was standing up from my desk at work.
I'm gonna go ahead and percuss your legs and check for any pain.
And there's some pain at the bottom of the knee.
Right here?
Yeah.
How about here?
Yeah, there too. It's like dull.
So the kneecap is impacted. Palpating around it. Do you feel any pain here?
Not at the top, no.
So it's just the bottom. Okay. Do you feel this?
I feel it, yeah.
And this?
Mm-hmm.
This?
Mm-hmm.
Okay. And how about this?
Yeah, I feel it. I feel it less there toward the bottom of my leg, but I still feel it.
You feel that?
Mm-hmm.
Okay. Do you feel this?
I feel it less on my foot and the bottom of my leg. I feel it more the higher you go up.
How about this?
It feels kind of tingly and weird up next to my toes. Yeah, it's like a weird, numbing, tingling sensation on my feet.
Okay, let me go ahead and take a look.
It feels really tingly on my toes.
Do you feel me touching on your big toe?
No, actually.
Do you feel me pulling on your big toe towards your head?
I feel it like on the base of my toe.
On the base, but not at the top.
Mm-hmm.
Okay. So there may be some nerve damage towards the extremities and alongside the shin here. Definitely a neurological impact from cold exposure. Can you curl your toes around my finger? Not too much. Okay. They are very cold, so the blood flow must not be optimally flowing here. Okay. Do you feel this?
No. That I feel. I feel it, but it's like feels weird, kind of like tickly, tingly.
Like this?
Same thing. Same thing there too. And that made a nerve sensation above my knee actually.
Oh,
Yeah.
okay. So you felt it here?
Like above my knee and my mid thigh.
Okay.
I felt it like shoot up there.
Can you tell me if it happens again?
Yeah, it's the same thing.
Interesting. Okay, so definitely nerves are impacted. Okay, I'm gonna go ahead and check the plantar region of your feet as well.
Okay.
So we're definitely dealing with nerve damage on the right side of the foot and the leg here, and that is radiating up all the way towards your neck area, so the right area is mostly impacted. I'm gonna go ahead and palpate the plantar region. Let me know if you feel any pain.
I feel some tenderness on the middle of my sole.
Right here?
Yeah, like at the middle, in the center. It's tender.
The feet are not swollen, but the right plantar region is more tender than the left. Okay. Just say yes when you feel me touching you.
Okay. Yes. 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 I felt it very subtly, less than the other. No, I don't really feel anything there. Yes.
Eight and 8. 3 and 3. 22 and 22. So expected symmetry is in place. Go ahead and push into my hands with your pad. Good. And now try to use just your toes to push into my fingers. So left one is good, right one impaired mobility and strength. Okay. Okay, Anastasia, this concludes the assessment for today. I was able to find some nerve damage especially on the right side of your body, which is much more impacted from the cold than the left side. So I do want us to first take a CAT scan, right? And just make sure that there's nothing underneath the skin in the deeper layer of the tissue that's impacted from the frostbite. And then if that's not the case, then we'll just go through a dermatological treatment to just get your skin back to where it's supposed to be.
Okay, sounds good. Thank you.
I did prescribe you antibiotics for the ear infection.
Okay.
I sent those to your pharmacy.
Perfect.
And let's come back and see each other in about 2 weeks to see how your skin has progressed, and then review the results of the MRI.
Sounds good. Thank you.
Yeah, thank you as well. Good to see you.
You too.
Welcome back, Harita.
Hi.
My name is Dr. Lula, and I'll be doing your medical checkup today. May I please verify your date of birth?
My date of birth is August 20th, 2002.
All right. And when was your last checkup?
It was almost a year ago.
Were there any abnormal findings during that procedure?
Yeah. I was diagnosed with arrhythmia.
Okay.
And I've been also feeling palpitations.
Heart palpitations?
Yeah.
Okay. How long have you had them for?
I've had them for a few months now.
All right. Are you on any medication for that?
I take a beta blocker.
Anything else? Any other medication?
No.
Okay. In addition to the heart palpitations, do you feel any dizziness or any headaches?
I have been feeling a lot of dizziness.
Okay. And how often do you feel that?
Every other day.
How bad is it on a scale of 1 to 10?
I would say 8.
Okay, so that means you have to stop what you're doing and lay down.
Yeah.
Okay. So it's probably preventing you from going about your day to day. Hi, Matt. Good to see you again. So we have an appointment today for a medical assessment.
How are you?
Good. How are you?
Good.
Tell me what's going on with you.
I've been a little bit better.
Okay.
So glad that I'm here. It started with my feet, and then I noticed something with my neck and ears as well. I'm having some swelling and tingling sensations.
Okay.
And also my right ear is kind of puffy and it hurts.
And when did that pain begin?
About 2 weeks ago.
2 weeks ago. And the swollen feet and legs, did that happen at the same time?
About a week in between them.
Week in between them. Okay. Do you have any idea what might have brought this about?
I have no idea.
Have you taken up any new activities?
No.
New sports, hiking?
No, just normal.
So you've maintained a normal lifestyle. Okay. And on a scale of 1 to 10, how intense is the pain in your feet?
About a 5.
And the ear pain, how bad is that?
It's about a 3.
Okay. Do you feel any tingling sensations, any pins or needle-like sensations?
Only in my legs.
Okay. Both legs or just one of them?
Both legs.
Both legs. Have you been swimming recently? Have you been in a body of water?
No.
Okay. And you mentioned no new exercising or physical activities that are outside of your normal routine. Are you on any new medication by any chance?
No.
Okay. And when is the last time that you've had your full blood panel done?
2 years ago.
Okay. So you're about due for a new evaluation there. Have you been wearing high heels recently?
No.
So you've not changed your shoes or?
Correct.
Okay. And how is your sleep? Are you sleeping well at night?
No. It's very disrupted. I would say I wake up almost every hour, try to go back to sleep.
Are you doing anything to manage that?
Well, I try to drink something warm before I go to sleep and just have a healthy lifestyle.
Okay. Any tinnitus or abnormal sounds in your ears?
Sometimes I do hear some, it's like a buzzing sensation, sound.
How about any headaches that don't go away?
I have some headaches in the morning too when I wake up.
Are you taking any medication for that? Any
No.
pain relievers? And tell me a little more about the sensations that you're feeling in your legs. How would you describe them?
Feels like the skin is kind of puffy and swollen, and that there's just pins and needles coming in throughout the whole area.
Have you noticed any redness?
No.
Okay, so no skin irritation, extra dryness, any abnormal colors that you're not used to seeing?
No.
Okay. Have you changed any of your bath products, such as shower gel, shampoo, conditioner? Have you made any changes with the lotions that you're usually using?
No. Didn't notice that they're getting cold a little bit faster, so my feet are constantly cold, and it's very hard to warm them up.
Okay, I understand. Are you taking any medications on a regular basis? Any vitamins, herbs, teas?
No.
Okay. And would you say that your symptoms have gotten worse, have stayed the same, or are improving?
They're staying the same.
Same. Okay. So you mentioned the sleep is not going very well. So would you characterize your feelings as just being fatigued throughout the day, or are you about the same in terms of energy levels?
I would say fatigued, definitely.
Okay. And you've also mentioned some headaches and neck. What's going on with your neck?
So the pain from the ear kind of radiates down the neck.
Goes down here?
Yeah.
Okay. And are you able to move your head right and left?
I am, but I do feel some numbness and tingling sensation
in your neck as well. Okay, let me just take a quick look. Yeah, I do see a little bit of redness. Okay. So neck area is also impacted. Have you had any specialty massages recently? Have you gone to a spa? Had any procedures done?
No.
Okay. And how is your vision? Are your eyes impacted in any way?
No.
Okay. Do you exercise regularly?
I try.
And you're able to exercise just fine. You don't feel any pain while doing
No,
that?
I do feel pain when I try to walk or jog.
Okay, so impaired ability to exercise. Any changes to your diet?
No.
Okay. And no supplements or vitamins or anything? Sounds good. Okay, so let's go ahead and give you a full body head to toe medical assessment today, and I'll focus on your ear here and legs and feet. And if you feel any pain at any moment, feel free to stop me.
Okay.
Wonderful. So I'm going to go ahead and put my gloves on. And I'll start off by taking your vital signs. Do you feel any pain right now?
No. A little bit in the legs, maybe.
Okay. So I'm going to go ahead and just look at your neck and your face. Just going to see how the skin reacts to a light touch. If you can move your head towards your left, going to look at your ear and neck area. And then I'm going to compare with the left side. Skin is very well perfused. I'm not noticing any abnormal colors or redness. I'm going to palpate your arms and check for any signs of edema or fluid buildup. I'm also going to inspect the inner portion of your arm. And palpate. Checking the joint for any crepitus or clicking sounds. That's good. And your inner left arm. And the joint. A little bit of clicking here. So the upper limbs look fine. No signs of any fluid buildup. No abnormal discoloration of the skin. I'm gonna go ahead and check your pulse. At your carotid artery first. Good. And over your brachial artery. Good. As well as the radial pulse. 2, 3, 4, 5. Good. Go ahead and squeeze my hand. Perfect. Good level of strength there. I'm gonna go ahead and listen to your lungs and heart. Okay, go ahead and just relax. I'll be hearing normal sounds coming from the heart, and S1 and S2 is present. I'm also going to use the bell side. S3 and S4 are absent. No murmurs and clean sounds coming from the ventricular muscle. Okay, let's take a look at your lungs as well. Okay, now I want you to take a deep breath in and out. Okay, good. Okay, you can breathe normally now. Good, clean sounds coming from the lungs. I'm also going to check the presence of any bruit over your carotid artery. Good, no bruit is present. So lungs and heart sound okay. Physical appearance is normal. Upper limb edema is absent. Heart and lungs presented no positive findings. Wonderful. Have you had any flu-like symptoms in the last 2 weeks?
No.
Okay. So we're going to go ahead and take the blood pressure today. And I'm also going to check your temperature. this is going to go inside your mouth, and please hold it there for me. And we're also going to check the level of oxygenation in your blood. Perfect. Wonderful. 97.5, so no fever. Good. 99.5 oxygenation and about 65 beats per minute. So we're not concerned with the level of oxygenation in your blood, which is a very good sign, given that your lower limbs are swollen. Wonderful. Okay. And let's check the blood pressure. Is it okay if we use this arm? So I'm going to match up the artery here with the side, and make sure this is nice and snug. And go ahead and open your fist like this 10 times while holding your arm above your head. Perfect. This will circulate the blood and make sure that we get a good, accurate reading. Perfect. Okay. Wonderful. So blood pressure was within normal range for a woman your age. I'm not concerned with any hypo or hypertension. Good. Okay, so that concludes the vital signs. I'm gonna go ahead and just feel your head next. Check for any lumps, bumps, anything abnormal. Okay. And I'm gonna start by applying tension first, laterally. Any pain there?
On the right side.
Gonna check for any indentations. indentations are present. I'm not feeling any nodules. I'm gonna go ahead and palpate the base of the head. And the mastoid bone process behind both ears. Good. I'm gonna go ahead and feel your lymph nodes. The front of the ear, auricular and posterior auricular. Tonsillar, submandibular and mantle. Now focusing on the right side of your neck area here. Okay. Now I'm going to check your supraclavicular lymph node. Go ahead and shrug up for me. Now down. Wonderful. I'm also going to check your axillary and pectoral lymph nodes. Good. That's not enlarged. Okay, wonderful. Okay, next up I'm gonna look inside your ear and check out your tympanic membrane. If you can move your head towards your left. I'm gonna go ahead and visualize the tympanic membrane. Okay, I can see a pearly gray filament. Bony landmarks are present. Cone of light is also present. I'm not seeing any redness or discharge that might indicate any infection. So that's all quite normal. Good. Okay, let's go ahead and check your other ear as well. Okay. Okay. Let's go ahead and take a peek inside your left ear as well. Okay. No redness or swelling. Cone of light is present. normal tympanic membrane, good ratio. Wonderful. Okay. Next up, I'm going to check the dermatomes and the skin sensitivity on your arms, your chest, your neck, and your face. So I have here something sharp and something dull. So go ahead and tell me what you feel.
Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull.
Wonderful. Now, is that sensation about the same as this one?
Yes.
Okay. And now, can you tell me if I'm touching you on the right side of the body or the left?
Right. Left. Left. Right. Left. Right. Right.
Wonderful. And how about now, left or right?
Left. Right. Right. Left. Right. Left.
And now count how many times I'm touching you.
3.
Good.
1. 3.
Very good. And can you tell me if the right side or the left side is more intense?
Left.
Good.
Right.
Good.
Both.
Good.
Both.
Very good. All right, let's go ahead and lay down and I'll take a look at your scalp and then we'll focus on your legs and your feet. Inspecting the scalp for any abnormalities of the skin. Especially around the affected right ear. scalp is clean, no dandruff, no psoriasis. I'm not noticing any excess dryness or redness. Palpating the neck. And the temples. I'm gonna tap on your sinuses. Checking for any fluid buildup, any pain upon tapping. Maxillary sinuses are clean, and frontal, ethmoid, and sphenoid are not indicative of any fluid buildup. Okay. I'm going to do a sharp or dull test on your hairline here as well as the scalp. Go ahead and tell me if this is sharp or dull.
Dull. Sharp.
Good.
Sharp. Can feel that. Sharp.
And is this cold or warm?
Warm. Warm.
Very good. Okay, I'm gonna create another partition here. And inspect the skin. Wonderful. Do you feel this?
Yes. Yes. Yes.
Good. I'm going to cause a vibration and I want you to tell me when you stop feeling it. Do you feel that?
Stopped.
Good.
Stopped.
gonna go ahead and check your abdomen next. Okay, is it okay if I unbutton your gown?
Yes.
I'm going to begin by doing a visual inspection of your abdominal cavity here, and I'm looking for any skin indentations, any abnormal colors, scarring. I see that you have one scar here. Was that a mole that was removed?
Yes.
Okay. And did you have it biopsied?
Yes.
How were the results? Were they normal?
Everything was normal.
Benign. Good. And I do see you have a tiny red scar, well-defined borders, one color, and another one that seems to have a brown and then a darker brown shade. I'm gonna go ahead and take a look at that. Going to use my thermoscope here. It's about 2 millimeters in size. I'm not very concerned, but we should keep an eye on it. I'm also going to check out the belly button for any discharge. No discharge or redness present. And the red mole is about 3.5 millimeters, one color. The borders are a little irregular though. We're definitely going to wanna monitor that. Okay. Now I'm going to check for any obvious indentations. Good. No indentations present. I'm gonna listen to the abdominal sound. I'm also going to check your aortic pulse. Good. And I'm going to feel the point of maximum impulse in between the 1, 2, 3, 4, 5 intercostal space. Right there. That's where I'm going to be able to feel the pulse as well, not just listen to it. 1, 2, 3, 5. Good. So that's quite normal. Going to do a deeper palpation now. Check for any masses or enlarged organs. Muscle mass is normal. Stomach is not enlarged. And I can barely feel the tip of the liver, which is also within normal proportions. And the spleen is normal as well. And no pain present towards the lower abdominal area. Good. Any pain when I press down on the belly button? Good. Okay. Now I'm going to cause a vibration and test your sensitivity to air fluctuations as well as heat. Do you feel that? Good. And did that stop? Okay, can you detect that? No. Okay. How about that? Can you feel that? Okay. And is this hot or cold? Cold. Good. Cold. Good. Could you feel that? Yes. And that? Yes. Is this hot or cold? Cold. And how about that? Cold. That? Cold. 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 Okay. So, some loss of sensitivity with the skin in your abdominal area, especially as it relates to vibrations and the ability to detect changes in air pressure through vibration. I'm gonna go ahead and focus on your feet and your legs next. Alright, I'm gonna go ahead and close your legs. And I will begin by doing a visual inspection. Checking for any colors that are abnormal, moles, scars, signs of edema that I can see. I am noticing that your legs and your feet are quite swollen, both of them equally. Especially the pads, they are very, very swollen. So we could have a little bit of blockage here that we can relieve with a massage to drain the lymphatic fluid that may be building up. Toe inspection appears normal. Capillary refills within 2 seconds. Vital pulses are synchronized, about 2 plus. Toe mobility is not negatively impacted. Go ahead and try to bring your toes towards your head. Perfect. And now point them towards me. Good. Now I'm going to hold on to your toes. Go ahead and try to bring the rest of your toes towards your head. Now point them towards me. Very good. And now push into my hands with your pads. Perfect. And now just try to touch my hands with your toes. Perfect. Can you tell me which leg I am touching you on? And how about now? Which leg am I touching you on?
Left.
And now?
Right.
Good. About now?
Right.
Now?
Left.
Good. Now I want you to tell me when you stop feeling any touch.
Now.
Good.
Now. Now. Now.
Okay, can you bring your feet more up like that so I can inspect the plantar region? Okay, I'm going to do the Babinski test. Good. Good. And now can you tell me which toe I'm touching you on?
Right.
Good. Now.
Left. Right. Left.
Okay. Is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
And how many times am I touching you? Count.
3. 3. 3. 1.
Good. Can you wiggle the toe that I'm tapping? Good. Good. Now, can you wiggle the toe again? Good. All right, I'm gonna go ahead and perform a lymphatic drainage massage to address the blockages in your lower limbs. Going to start off with some essential oils. This is going to improve circulation, relieve tension, and get the blood flow going. So that the fluid is released and a normal blood flow can happen again. Sometimes if we are standing for too long or using our feet for extended periods of time without any relaxation, we can get blockages that build up tension. this lymphatic drainage massage is going to help reduce some of this inflammation. Especially on the upper area of the metatarsals. Stretching the toes will help release the fluid. Stimulating the blood flow. And applying pressure to help on blockages be eliminated. Okay. Now I'd like you to turn face down so that I can also massage your calves and the plantar region. Your calves also seem very, very swollen. The natural essential oil is going to permeate the skin and stimulate the blood flow. I'm going to apply a generous amount. Draining the buildup of fluid in your calves. I'm noticing normal neurological reactions in your plantar region, which is encouraging. Same observations for your right plantar. This is going to feel a little cold. We're continuing to drain the fluid and improve circulation by promoting an increased blood flow. Okay. You can get up now, get dressed, and can discuss the results. Okay, Matt, so this concludes the assessment for today. I did a neurological assessment starting from your skin area on your scalp, your abdomen, legs, and feet. I haven't found anything out of the ordinary. You had some distortions to vibration sensitivity on your abdomen and some loss of sensitivity in your legs. I did a massage that hopefully will help relieve some of that fluid buildup. I would recommend that we monitor your condition, and then if it doesn't improve, we can start with an MRI.
Okay, sounds good.
Do you have any questions for me today?
No.
Okay, then I will see you back in maybe a month.
Thank you.
Okay.
See you soon.
Any shortness of breath?
No.
Okay. Have you noticed the heart palpitations and the dizziness getting better or worse over time?
I think it's kind of stayed the same over time.
Okay. Any chest pain or discomfort?
A little bit.
Okay. Can you show me where you feel that?
I'd say like over here.
Okay. Right there? Okay. Does it radiate anywhere else in your body, or? Okay, so it stays localized.
Yeah.
Got it. Have you had any fainting, any episodes of syncope?
No.
So no losing consciousness during the dizziness?
No.
Okay. And how's your energy level overall? Do you feel tired often?
I do actually feel tired often.
Okay. And do you feel like you get enough sleep at night?
I actually do get enough sleep.
How many hours would you say you usually sleep for?
Say 7 to 8.
That should be enough to go about your day without feeling tired.
Yeah.
Any troubles with your ears and hearing?
No.
All right, Rita, let's go ahead and begin your annual checkup, and I'll focus on the cardiovascular system today, as well as your back, your legs, and your feet. Okay, I'm going to set this aside and put on the medical gloves. And I'll start off by taking your vital signs. Are you feeling dizzy right now?
I think I'm okay right now.
And how about the chest pain? Do you feel it?
It's pretty normal right now.
That's good. That means we're going to get a pretty good baseline for you. Okay. So I'm going to take your temperature first. This is going to go over your forehead and behind the ear. 98.2. So you do not have a fever. I'm gonna check your heart rate as well as your oxygenation. The index finger right there. Okay. You can just keep this here. And I'm just going to feel your pulse on your neck. Is it okay if I touch you on your neck? Okay, good. That feels normal. So carotid is normal. I'm also going to check your pulse brachially. Good. And Your heart rate is 100 and 99% oxygenation, so that is all good. Just going to make a note of that. So temperature was normal, heart rate and oxygenation within normal parameters. I'm going to go ahead and listen to your heart and lungs. Go ahead and relax. And this may be a little cold, so I apologize about that. Okay, just breathe normally. Not able to hear any murmurs. Good. Take a deep breath in. I'm going to assess your lungs and out. Okay, deep breath in and out. You can breathe normally now. Good. So heart and lungs sound okay. I'm just going to observe you physically first. So go ahead and just relax. I'm looking for any abnormalities that are physically present that would indicate anything that we should further investigate. So looking at your neck and the chest. And on the inside of your arm. Okay, that's normal. No obvious abnormalities of the skin. I'm gonna go ahead and palpate your arms first, but before that I'd like to assess if you have tremors. So go ahead and elevate your arms like that. Good. And let me just observe them. You can close your eyes and I want to see if you're able to keep them at the same level. 1, 2, 3, 4, 5. Good. No tremor is present. I'm going to go ahead and palpate and check for any signs of edema or any pain that is more than usual. Can you move your head left to right? Perfect, and then back. Okay. And forward. and then back. Perfect. Okay, I'm gonna go ahead and check your blood pressure. Have you had this done before?
Yes.
Okay, is this arm okay?
Yes.
Wonderful. So let's go ahead and match this over the artery. Right. Go ahead and just relax. Right, very well. You can just slide this. So blood pressure was a little elevated. Have you noticed before that your blood pressure is elevated? 130/85. Or is this the first time you were told?
This is the first time.
Okay. Right. You may want to consider maybe cutting down a little bit of the salt in your diet. That should help lower the blood pressure.
Okay.
All right. Next up, I'm going to check your reflexes. So I like to close your eyes, and I'm just going to tap on some bony prominences of your body and check the neurological response. I'm going to start at the top of the head here. Okay, good. Good eye reflex. Good. Can you open your mouth a little bit? Slightly. Perfect. Good. Okay, relax your arm. Good. Checking for the tendon. Okay. Good. Wonderful. And then can just leave all the weight into my arm. Okay, good. And same here. Good. Good. Okay. Next up, I'm going to palpate your head and your neck and feel for any inflammation of the lymph nodes, any masses that are under the skin. Is that okay?
Yes.
checking your lymph nodes. Tonsillar, submandibular, and submental. No elevations are noted. Moving down to the cervical lymph nodes. Occipital. Good. Deep cervical in the back. And then supraclavicular. Go ahead and shrug for me. Yep, shrug up. Perfect. And then lower your shoulders. Good. Okay. And then pectoral and axillary. Good. So I'm not noting any inflammations of the lymph nodes. Okay, go ahead and look into the distance for me. I'm going to check your eyes. Good. And now look at my nose. Perfect. And now look into the distance again. Good. I'm going to pull down on your eyelid. I want you to try to look up. Okay. Good. And now look down. Good. Perfect. When did the watery eyes start?
Maybe a month ago, I think.
Okay. I'm not seeing any physiological abnormalities. So we may just treat the watery eyes with some over-the-counter drops.
Okay.
I'm going to assess your optic nerve to be really sure there's nothing internally wrong. Go ahead and look into the distance. Wonderful. So optic disc and optic nerve are intact. I wasn't able to see anything wrong with the retina. And well-defined margins. So eye exam checks out. I'm gonna go ahead and take a look at your scalp next. Have you noticed any itchiness, any redness, any pain when you're brushing your hair or showering? Okay, wonderful. You have very thick hair. I'm not noting any abnormal breakages. And I'm able to visualize your scalp. No redness. Can you move your head towards your left? And then towards your right. Good. Okay, next up I'm going to take a couple of measurements and note the symmetry of your limbs. May you please elevate your arms just like that. Okay, we're at 72. 72 and a quarter. Good. You can lower your arms now. 18. Good. 36. 17. Good. I'm going to assess the dermatomes of your skin, and I'm going to touch you with this spatula on your left or right arm. I want you to keep the eyes closed and tell me if you feel me touching you on your left or right side of the body. Good. Good. I'm also going to touch you on your face. Good. Okay. Do you feel this equally on both sides of the forehead? Yes. And about the same? About the same? Yeah. About the same? Yes. Okay. Next up, I'm going to touch you with something either sharp or dull. This isn't very sharp, so it won't penetrate the skin, but you will feel a very different sensation. Okay. Keep your eyes closed and say sharp or dull. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Very well. Next up, I'm going to cause a vibration and I'm going to place it at various positions on your body, and I want you to try to localize that. Okay. Good. Wonderful. And now I want you to tell me when you stop feeling the sensation. You don't feel it? Let's try it again. Do you feel the vibration?
Yes.
Did it stop?
Yes.
Good. So just say now when you stop feeling it.
Now.
Good.
Now.
Good. This is wet and this is dry and soft. So I want you to say wet or soft.
Okay. Wet. Soft. Wet. Wet. Soft. Soft. Wet. 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 Soft. Wet. Soft. Wet.
Good. I'm also going to focus on your ears. And you said you've not noticed anything abnormal with your ears. Okay. Any discharge or ringing, none of that. I'm gonna just feel around them. Checking the mastoid bone process. And applying some pressure on the front temporal lobes. Good. Does this hurt? And this?
No.
Wonderful. Go ahead and tilt your head towards your left. Going to take a quick peek inside. With my otoscope. No discharge tympanic membrane has well-defined borders. I'm able to visualize the bony landmarks and just a little bit of wax buildup within normal parameters. Your head towards your right. Visualizing the ear auricle. Gonna take a peek inside. Ear canal is normal, unclogged, no discharge, no redness.
and normal tympanic membrane, no wax buildup.
Ear exam, scalp and hair normal. Dermatomes and skin, neck and chest, no positive findings. Let's go ahead and check your nose and mouth. Have you noticed any discharge from your nose, any dryness of the mouth? Okay, wonderful. Just gonna take a peek inside. No obstructions noted. Go ahead and take a deep breath in through your nose and out. Okay. And do that again. Good. Nostrils are not obstructed. Go ahead and open your mouth and say ah. Okay, good. Teeth are intact and no redness in the back of the throat. Mouth and nose, a pass. I want you to squeeze my hands now. Good. And I'm going to attempt to push you backwards. Don't let me do that. Good. Okay. Let's also do a hearing test. Keep your eyes closed and try to count how many clicks you hear. Good. Wonderful. And now I'm going to make a sound either by your left ear or by your right ear. Go ahead and say left or right. Good, that was a trick question. Good. Okay. Let's go ahead and lay down and I'll take a look at your back and your feet and your legs. I'm gonna go ahead and inspect your back first. I'm going to feel for any masses process underneath the skin. Good. And now I'm going to palpate your spine. The scapula. Good. And I'm going to percuss. And tap around your spine gently. Good. No abnormal neurological reactions. I'm going to cause a vibration again. Place it on your skin, and I want you to tell me when you stop feeling it. Good. Do you feel it?
No.
It stopped. Good. So I'm going to assess your feet and your legs next. Is it okay if I remove your socks?
Yeah.
And can I elevate your sleeves, the jean sleeves?
Yeah.
Exposing the knee and the tibia. Your feet are cold. Is that normal for you?
Yeah.
Gonna need a bigger light. Sorry. So looking at the color of the skin and the nails, no clubbing or pitting is noted. Okay. going to feel the pedal pulse first. Good. And I'm going to cross compare, synchronized, and the popliteal pulse. Good. Palpating for any signs of edema. Good. Checking in between the toes. And can you attempt to bring the toes towards your head? Good. Now I'm going to attempt to spread your legs. Don't let me do that. Resist. Good. I'm going to attempt to bring your feet together. Don't let me do that. Resist. Good. Now can you push into my palms with the pads of your feet? Perfect. And try to push with the heels as well. Good. Alright. Plantar region looks normal. I'm going to go ahead and do the Babinski test. Okay, no positive findings for Babinski. I'm going to go ahead and tap on your legs, tibia bone, metatarsal bones. No abnormal reactions. Palpating the plantar region for any obvious pain. Good. And now push with your toes into my arms. Good. Go ahead and tell me if you feel me touching you on your left foot or your right. Right. Left. Right. Left. Right. Left. Good. Go ahead and scoot up a little bit. Checking the patella in your knees. And the fibula in the back. And let's check the reflexes as well. If you can just, there you go. And relax the foot. Good. And let's arc the leg. Good. Now I'm going to touch with something that will be a continuous touch. Go ahead and say when you don't feel the sensation anymore. I'm also going to listen to your pedal pulse. Okay, heart rhythm. So, did a very thorough investigation. Head, neck, cardiovascular system, ears, eyes, dermatomes. So, the neurological connections between your brain and the skin. Sensations, legs and feet. So you mentioned that you are on a beta blocker.
Yes.
That's probably the propranolol. Is that correct?
Yes.
That's usually prescribed for arrhythmia. And do you know how many milligrams you are per day with that?
I'm not sure.
Okay. So I'm gonna write down the smallest dosage and let's confirm at the next checkup.
Okay.
And how many times a day are you taking that medication?
Once a day.
Once a day. Good. Okay. So that completes the assessment.
Okay.
Thank you for coming in today, and let's reassess where you are with your heart in about 6 months.
Okay. Thank you.
Hi, Anastasia. My name is Dr. Lux, and I'll be doing your medical checkup today.
Hello, Dr. Lux. Thank you.
Thank you for coming in as well. Very nice meeting you.
Likewise.
And I see here that you sent over your chart from your previous doctor.
Mm-hmm.
Okay, let's just verify some brief information about you. May I please have your first name and date of birth?
Yes, my first name is Anastasia, and my birthday is February 26, 1999.
Wonderful. And when was your last checkup, Anastasia?
It was about 6 months ago.
Were there any abnormal findings during that?
Then everything was fine, but lately I've been having some insomnia that started about 3-4 months ago, some headaches that came with that as well. I've been having trouble falling asleep and been having some fatigue also.
Okay, I'm sorry to hear that. You mentioned insomnia, fatigue, headache. Can you localize your headache?
It's mainly in the front and like top middle area.
Okay, is it okay if I touch you?
Of course.
So front and then towards the top.
Mm-hmm.
Medium. Okay. And did the headache and the insomnia begin at the same time?
No, the insomnia started around 3-4 months ago, and the headaches followed a few weeks after.
So the headaches followed.
Mm-hmm.
Okay. Have they gotten worse or better, or have the symptoms stayed the same?
They've been mostly the same. Sometimes it's actually pretty okay for a few days at a time. It gets worse at night when I'm trying to fall asleep.
Okay. So worse at night.
Mm-hmm.
On a scale of 1 to 10, how bad is the headache?
Sometimes it's around 8, so it's usually around a 6, I would say. I've also been having some heart palpitations too, like some dull pain in the heart area sometimes.
The pain, how bad is that on a scale of 1 to 10?
Right now, probably around a 3.
Do you feel it right now?
Around a 2, 3.
Okay.
And I have some feelings of like electricity in the heart area and like a fast resting heart rate when I'm trying to fall asleep sometimes.
Do you feel like you're easily running out of breath when you walk up a stair?
Sometimes, yeah. More than it used to be.
Are you on any medication?
No, not at all.
Any allergies?
Yes, I'm allergic to strawberries and peaches, but it's not too bad. Usually my face just gets red and my throat gets a little itchy, but it's nothing too severe.
And you mentioned the insomnia. So how many hours do you say you get to sleep at night?
I fall asleep pretty late. If I can sleep in, I think I can maybe sleep around 7, 8 hours, so it's not that bad. But I usually have to wake up early, so maybe like 4 to 6.
4 to 6. So that's on a bad night. Okay. Do you have any medical history I should be aware of? Anything in your family, mother's side, father's side?
Yes, my mom used to have anemia in the past.
Okay.
And then on my dad's side, his mom had hypertension and diabetes.
And diabetes. Do you know if you have any hypo or hypertension?
Not as far as I know. I think I'm okay.
Any changes to your vision?
My vision itself is fine, but sometimes I have this kind of like watery eye sensation, like I have sand in my eyes, but the vision itself is fine.
Okay. And when was your last eye exam?
Like a year or 2 ago.
1 year. So more than 1 year. Okay. Any changes to your hearing? Any ringing in the ears? Any loud sounds that are...
I do have ringing in my ears sometimes at night, but it's not too frequent though.
Okay. And does that come at the same time as the pain?
Yeah.
The head? Okay.
Not always, but usually it's at the same time.
All right. Any difficulty breathing?
Mostly fine, but I do get lightheaded sometimes. So sometimes it comes with shortness of breath, but it's not that bad.
Okay. So I'll go ahead and do a full medical checkup for you today, and we'll focus on your cardiovascular symptoms and head, eyes, ears. And hopefully we're going to get to the bottom of what has been going on with you. Are you following any particular diets or anything?
Nothing too strict. I just try to eat healthy, try to eat lots of veggies.
Good. So you're not vegan or not following the keto diet or anything? Okay. Sounds good. So I'm going to go ahead and set down the chart and put on the gloves. And I'll begin by taking your vital signs.
Thank you.
And do you have any pain right now?
Just in my heart area. I had a bit of a headache on the way here, but it's mostly gone away.
So let me listen to your heart and lungs. And is it okay if I slide this inside your shirt?
Go ahead.
Go ahead and breathe normally. I'm listening for any murmurs, any abnormal sounds from the heart. I'm gonna listen with the bell side as well for the more superficial sounds. I'm able to hear S1 and S2. No extra sound. Heartbeat is a little on the low side. Not hyperdynamic, but definitely on the lower end. Okay. Let's check your lungs too. Take a deep breath in and out. Deep breath in and out. Good. You can just breathe normally now. I'm also going to check your carotid artery. No bruits. Good. Okay, I'm going to set this aside and just go ahead and check your oxygenation. So this is going to go on your index finger, and you can rest this right here, and I will check your pulse, and I'll start again by your carotid artery. Checking it manually too. Good. And over your brachial artery. Checking the character of the pulse. Good. And by your wrist. Wonderful. 99% oxygenation, and just like I heard, the heart rate is a little bit on the lower end. Are you athletic? Do you exercise regularly or sports?
I play tennis a couple times a week, and I'm just getting back into weightlifting around 3 times a week for now. And sometimes I go for a run or a walk.
Okay.
That's mostly it.
Heart rate was about 60 beats per minute, which is consistent with an athletic type body. But I didn't hear any extra sounds, no hissing in the lungs, no adventitious sounds, so no bronchitis, pneumonia, and all the heart sounds were normal. So I'm not concerned. And let's go ahead and check your temperature as well. Any flu-like symptoms?
No.
All right, 97.5. So temperature is normal. Let's go ahead and check your blood pressure. Have you had this taken before?
Yes.
Okay, so you know what to expect then. I'm gonna go ahead and set the chart over here. And is your right arm okay?
Mm-hmm.
Good. Let's put the cuff nice and snug around your arm. Good. And the sphygmometer over here. I'm gonna go ahead and close the valve. And legs are uncrossed. Go ahead and just relax. Good. So blood pressure on the low end of the spectrum here, 95/60. Are you dizzy right now?
Not right now, but sometimes I do get dizzy and lightheaded. But I'm okay right
That may just be normal for you, especially if you're working out a lot. So let's go ahead and make a note of that baseline. 95/60. Normal temperature. Normal heart rate, a little on the lower end. So I'm going to go ahead and just look at your physical appearance first. Checking for any skin rashes, any external immediate signs of any underlying conditions. You can just relax. And I'll start with your face. Checking the overall appearance of the skin. Checking your chest for any abnormalities of the skin. No bruising, no blue or purple colors. Neck looks normal. Let's check your arms too. The inside of the arms. That's normal. And your left arm as well. Good. Now go ahead and keep your eyes closed and tell me if I'm touching you on your right arm or your left arm.
Right. Left. Right. Left.
And now the left or the right side of your chest.
Right. Left. Left. Right. Left. Right.
Okay. I'm gonna go ahead and tap on the bony prominences of your body, and I'm looking for any abnormal neurological reactions. So let me know if you feel any pain.
Okay.
Starting with the top of the head.
I do feel some slight, like dull pain, some discomfort.
Okay.
A little bit.
Okay. How about here?
It's around the same there.
On a scale of 1 to 10, how intense is it?
It's only around a 3, 4.
How about on the side of the head here? Any pain there?
No, everything's fine.
And here?
Everything's okay there too.
Okay.
I feel some like pressure, discomfort, but it's okay.
Okay, how about here?
Everything's fine there.
And on the chin?
Everything's okay.
Good. Checking for the eye reflex. Good. Present. And how about here? Any pain there?
No pain. No pain. No pain. No pain. No pain. No pain either. No pain. There's a little bit of pain there, but it's very mild.
Let's turn that again.
It's like around a 3, I would say. Not too bad.
Any pain there?
No, just when it was higher.
Okay. So around your clavicle.
Mm-hmm.
Go ahead and palpate. I'm gonna check your lymph nodes. Sometimes swollen lymph nodes can be the size of a small cherry. I'm not feeling any inflammation or elevation here. So, supraclavicular lymph node is fine. Let's check the other side too. Okay. Yeah, no inflammation. I'm gonna check your lymph nodes on your neck as well. Cervical and deep cervical lymph nodes are not inflamed. Checking the occipital lymph node in the back of the head towards the spine. Good. And the preauricular in the front of the ear, posterior auricular. And the submental and parotid. Good. No elevations noted. And checking your thyroid. Trachea is midline. Thyroid gland is barely palpable. Okay, I'm also going to palpate your head and apply slight pressure to the sides and to the front. Let me know if it's too much.
I do feel some pressure on the front and back a little bit.
Checking for any elevations or asymmetries. So pain in the top. How about the back? By the spine here at the top of the spine. Any pain there?
Not so much pain, but I do feel more like a pressure sensation there. Mainly discomfort, but it's not very painful.
Okay, the head is symmetric and I'm not feeling any bumps. I'm gonna go ahead and use my comb here to just check the strength of the hairline. I'm not seeing the strands of hair breaking. So no abnormal hair loss. And checking the scalp. Okay, no dandruff. Hairline looks healthy. Scalp looks to have a normal color appropriate to your ethnicity. No signs of alopecia and no abnormal hair loss. Let me go ahead and check this other side as well. You can look over to your right. That looks normal. Let's go ahead and check your ears next. You mentioned some ringing in the ear. Is it the left ear or the right ear?
Usually my right ear. Sometimes it feels like it's both, but usually my right.
Okay. Any pain associated with that or just the ringing?
Just ringing and like some pressure. And maybe like pain on a scale of like 1 to 2.
Okay.
But nothing too bad.
All right, let's go ahead and take a look here. And you can move your head towards your left side. Good. I'm gonna take a look on the outside first. See if I can spot any discharge or any redness. And I'm not seeing anything. Oracle of the ear appears normal. Okay, let's take a look inside. I'm able to visualize the tympanic membrane. And you have a very tiny ear canal. I do see a little redness. And what appears to be the
beginning of a ear infection. Okay. Some slight wax build up, but within a normal amount. Okay, let me make a note of that. And we can try treating that with some antibiotics. So right here presents wet discharge and redness, but normal tympanic membrane. Are you allergic to any antibiotics?
Not as far as I know.
Okay, so no allergies to antibiotics. We can try some amoxicillin for 7 days, 3 times per day, 250 milligrams. Okay.
Thank you.
Let me go ahead and take a look in the other ear as well. Okay, checking the outside of the ear first. No discharge, no redness. And now I'm going to take a peek inside. Pearly gray tympanic membrane and no infection. Okay, I'm gonna set this aside. And let's go ahead and check out your eyes. Okay. Can you look up for me? I'm gonna pull slightly on them and check the sclera. Okay, look down. Good. And now look into the distance. I'm going to check the pupil contraction and dilation. Good. And now look at my nose. I'm going to check for that direct and consensual response. Okay. Right here. Good. Perfect. And I'm also going to measure your pupil. Look at my nose. 2.5. Look at my nose. 2.5. Okay. Go ahead and cover one eye. And look at the light. Now at my nose. At the light, my nose. Good. And now cover the other eye. Look at the light and my nose. The light, my nose. Good. And now leave both of your eyes uncovered and try to keep your head steady and just follow the light. Good. Checking for the eye mobility and the peripheral vision. Any pain here?
No.
Okay, I'm going to move it all the way to the other side and stretch out the muscles. Any pain here?
A little bit.
Okay. Pain here?
No.
Pain here? So just on the median, lateral end. All right. And now I'm going to bring the light close to your nose. Try to follow it as much as you can. Good synchronized movement. Perfect. Okay, so a little bit of eye pain on your right eye. Any double vision while I was moving the light from one end to the other?
No.
Okay.
My eyes do feel a little bit watery right now. Just a little bit. My vision's okay.
And on a scale of 1 to 10, how painful was that?
On the side, like a 4. 4 or 5.
Okay. Go ahead and close your eyes. I'm going to try to open them. Don't let me do that. So resist that. Good. And now puff out your cheeks. Don't let me unpuff them. Good, perfect. And try to touch my fingers here with your tongue inside. Good. And here. Good. And now try to raise your eyebrows and then lower them. Perfect. Okay. I'm gonna go ahead and check the optic nerve. So taking a look at the back of the eye. Check the health of the cornea. Okay, you can look into the distance and just keep your eyes open. Perfect. Good. I'm going to take a look at your left eye as well. Okay, look up, look down, left and right. Good ratio, optic nerve is intact. No concerns. I'm gonna set this aside. So I have here a Snellen chart. I would like you to hold it with your left hand and move it away from you as much as you possibly can, right? And now with both of your eyes uncovered, read me this top letter.
E.
Okay, and you see the bottom line here?
Yes.
Can you read it from left to right?
LTFPH.
Good. And now can you please cover your right eye with your right hand and read that bottom line for me backwards?
HPFTL.
Good. And now can you read the third line from the top backwards?
HPF.
Good. And what color is this?
Green.
And is bubble number 3 bigger or bubble number 4 bigger?
Bubble number 4.
All right. And now can you hold this with your right arm and cover your left eye? And let's read this top letter here.
E.
Good. And the bottom line again from left to right this time.
LTFPH.
What color is this?
Red.
And is bubble number 2 bigger or bubble number 6?
Bubble number 6.
Okay. And what letter am I pointing to now?
F.
Good, perfect. So 20/20 vision. I'm not concerned with that. Not sure yet what the pain in the eye is about, but vision is 20/20. Can you press on your right eye for me? Is that painful?
No, it's okay.
Let's go ahead and do a couple of hearing tests. Keep your eyes closed, and I'm going to make a sound either next to your right ear or your left one. So go ahead and say right or left.
Okay. Left. Right. Left. Right. Both.
Yes.
Left. Right.
Okay. Next up, I'm going to check your dermatomes, and I have here a spiky object. It's not too sharp, so it's not going to penetrate the skin. It's just going to give you a very sharp sensation. And soft object. So keep your eyes closed and say sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Dull.
Okay, very well. And now I'm going to touch you with the spatula here, and I want you to keep the eyes closed and tell me when you stop feeling it. So just say now when you don't feel it anymore.
Mm-hmm. Now.
Good.
Now.
Good. And was that sensation about the same on both of your arms?
Yes.
Okay. I'm gonna do the face next.
Now. 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 Now.
Good. And was that sensation about the same?
It was colder on my left side.
Colder on your left side. Can you point to where you felt it the coldest?
More so on my cheek. I noticed it more on my cheek.
Okay. Interesting. Okay, let's do another test. And now I'm going to touch you with something either wet or cold.
Okay.
So go ahead and keep your eyes closed.
Wet. Cold. Cold. Wet. 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 Cold. Wet. Wet. Wet.
Okay, so a little bit of mixing of sensations of wet and cold on your left cheek. So we may have some loss of sensitivity there. or rather dermatome damagement. Maybe some nerve damage. We'll have to investigate further. Okay. So I made a note of that. I'm going to give you something to smell, and I want you to tell me what it smells like.
It's like rosy.
Rosy, very good. And now I want you to cover one of your nostrils. And let's try this smell.
That's minty.
Okay. So this was supposed to be lavender rather than minty. Okay. Now I'm going to give you something to taste. Let's see if you can identify the taste. Go ahead and stick out your tongue.
Citrusy.
Okay, that is correct. And go ahead and keep your eyes closed, and I'm going to spray you with a very fine mist of water. And I want you to try to point with your right hand where I'm spraying you. Good. 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 Very well. Take a couple of notes of that. So abdomen, arms, neck dermatomes are normal. No nerve damage. Just concerned a little about the left side of the cheek. I'm gonna start off by checking the circumference of your head. $53. Good. And let's check your arms. 22. Okay, 22. So that's symmetric. And to your abdomen across. I did not have the centimeter side. There we go. That's exactly 90. Okay, good. And let's check the symmetry of your arms. Can you elevate them like this, parallel to the ground? Okay, 67. And okay, about 67 and a half. Good. Wonderful. You can lower them now. All right, go ahead and lay down. And I'm going to take a look at your abdomen, legs and feet. Okay. Okay, Anastasia. Are you comfortable?
Yes.
All right, I'm going to begin by doing a visual inspection of your abdomen. And belly button. Is it okay if I lift up your shirt a little bit?
Yes, of course.
Checking how the skin reacts to a light touch, the level of blood flow, and the temperature. Okay, normal activity is heard. pressing down on your belly button. Any pain there?
No.
I'm going to check the skin for reaction to touch and check for any elevations. Okay, I'm seeing one mole, which is slightly raised. And where do you usually feel the pain?
Usually in like when I have a stomach ache, sometimes it's like in the middle.
Okay, so right here?
Like below the belly button.
Below the belly button. Okay. Checking for any abnormal colors, indentations. No discharge from the belly button and no redness. Checking the activity in the abdominal cavity. Switching to the bell sound for the more superficial sounds and the top layer of the dermis. Okay. So I'm hearing activity in all 4 quadrants. No swooshing sounds. Good. I'm gonna check your aorta. It's normal. Good. Gonna do a light percussion. Resonance sounds are normal, symmetric. I'm going to take a couple of measurements. normal level of symmetry is present. I'm going to go ahead and cause a vibration. Do you feel this? Okay. Go ahead and say now when you don't feel it anymore.
Okay. Now. No.
Good.
No. No.
Good.
No.
And I'm going to place it on top of the belly button. Do that again.
No.
Good.
No.
Wonderful. And now we're going to do the wet or cold test.
Cold. Wet. Cold. Cold. Wet. 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 Cold. 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 Wet. 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 Cold.
And do you feel this equally on both sides of your abdomen?
Yes.
How about this sensation? About the same?
Just the same. The same. The same.
How about now?
The same also. The same.
Very well. And sharp or dull?
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. I'm going to do a light palpation and check for any masses, any lumps, and any tenderness.
Okay.
Checking the spleen underneath your left rib cage. And on the tip of the liver on the right side. Go ahead and slightly raise your knee here, bend it, good, so that there's no tension in the muscle. I'm able to palpate the tip of the liver and I can barely feel it, which is normal. Okay, you can lower your foot here. And checking the size of your stomach. pressing down on your kidneys. Any pain there?
No.
Okay, no pain. Wonderful. I'm gonna go ahead and check your legs next and your feet.
Thank you.
All right, let's take a look at your legs and your feet.
Okay.
Just doing a visual inspection first. Okay. Checking for any visual signs of abnormalities, such as skin conditions or edema. Nails are not clubbing. No pitting is present. Can you wiggle the toes for me? Good. Normal level of mobility there. I'm gonna check your pulse. Pedal pulses first. 2 plus synchronized, and the popliteal pulse by the knees. Good. Normal. Feet are getting colder towards your toes here. Is that normal for you?
Yes, it's been like that my whole life.
Can you push into my hands with your pads? Good. So, how about with your heels? Wonderful. And can you elevate your feet one at a time? Perfect. Okay. So you have good strength there. All right, I'm going to go ahead and tap. And I'm going to check your patella first. Any pain there?
No.
Pain there?
No.
Okay. And your ankles? Any pain there?
Not there, but my left ankle is a little bit sprained right now. It's just slightly from playing tennis the other day.
Okay, let me go ahead and palpate it and see if I feel any inflammation. So I'm not feeling anything that's abnormal. No, nothing is. I'm not feeling anything abnormal, so nothing is swollen. Okay, taking a look at the plantar region and the toes. Any pain there?
No.
Okay, any pain there? Good. I'm gonna do the Babinski test. Good. Good. All right. Now, can you tell me if I'm touching you on your right foot or your left one?
Right. Left. Right. Left. Right. Left.
Good. And is this sharp or wet?
Sharp. Wet. Wet. Sharp. Wet. Sharp. Wet. Sharp. Wet. Sharp.
Very well. Okay. I'm going to take some measurements. 22 and 21 and a half. Close enough. 26. Good. So normal symmetry is present. All right. Anastasia, this concludes the exam. I did a very thorough head-to-toe assessment for you today. I'm not able to find anything abnormal other than the ear infection. So we're going to go ahead and treat that with some amoxicillin. And let's go ahead and monitor your symptoms. So I'd recommend that you come back in a month and then we do another follow-up.
Okay, sounds good. Thank
All right. Do you have any questions for me today?
No.
No. All right. So I'm going to go ahead and then send your prescription to the pharmacy on file.
Perfect. Thank you so much.
Thank you for coming in today.
Thank you.
So I see that you're interested in a head-to-toe sensory examination today.
Yes.
Okay. So what made you book this appointment with me?
Recently I've noticed I have some numbness in my abdomen.
Okay. Can you point to it?
Yeah, it's sort of my upper abdominal.
Okay. Can I just feel? All right. Do you feel me touching you now?
Yes, but it's very light. Like I don't feel it very much.
Okay. Well, I'm not feeling any obvious masses, lumps, or bumps. Okay, so upper abdominal, loss of touch. Okay, and when did this begin?
I think a couple days ago is when I noticed it.
A couple of days ago. Is this sensation or loss of sensation accompanied by any pain anywhere in your body, any tingly sensations, pins and needles?
I guess sometimes it feels a little pins and needles, but it's mostly just the loss of feeling.
Okay. Does this radiate anywhere else? In your lower back, your spine, fingertips, or toes?
I don't think so.
Okay. Are you on any new medication, Mary Rose?
No.
Okay. Any headaches, loss of hearing, blurred vision?
No.
And what were you doing when you first noticed this?
Well, I was outside and a breeze blew by and I noticed that I felt it everywhere except for my stomach.
Okay. And I assume you weren't wearing anything covering your abdomen.
It was a crop top.
Interesting. Okay. Have you had any major surgeries this year? Anything I should be aware of?
No.
Any joint pain?
No.
Back problems?
No.
Okay. Any difficulty breathing? Feeling like you're about to go out of breath? Feeling like you can't just, you're gasping for air?
No.
Okay. And how about any feeling of lightheadedness and, any... No? Okay. Have you noticed a dry tongue or a dry mouth?
No.
Okay, so what I'm going to be doing is a sensory examination of your abdominal area, and I'll focus on the skin in your abdomen and the dermatomes. And I'm also going to focus on just the nerves that power the rest of your body and do a sensory examination on your arms and your legs as well to make sure that there's nothing neurologically wrong with you that we should pay attention to.
Okay.
All right, so I'll go ahead and put on my gloves. And I'm just going to palpate you from this position a little more deeply, and I want you to tell me if just sitting like this, if you feel any pain.
Okay.
Okay, so I want you to kind of push yourself back like this with your hands and lean back a little bit, yes. Okay. Do you feel me doing this?
I do. There's no pain, but I feel it very lightly.
Okay. And do you feel me touching you now?
Yes.
Okay. All right, we can come back up now. I'm gonna check your vitals and get a good baseline of your heart and your lungs. Okay. And you can just breathe normally. I'm hearing S1 and S2 for sure. Good steady rhythm, not hyperdynamic, and I'm not hearing any extra sounds. Good. And I'm going to also listen to your lungs. And you're not a smoker, right?
Correct.
Good. Lungs are clear. I'm not hearing any wheezing or crackling, no signs of any bronchitis. And I'm also going to check the base of the lung in the back. Okay, good. And over on this side. Good. So lungs are clear. I'm gonna go ahead and check your levels of oxygenation. Okay, good. Can keep that right there. And I'm gonna take your temperature and I'm going to insert this slightly inside your ear. .5, perfect. .99% oxygenation and 76 beats per minute. Okay, I'm gonna make a note of these vital signs. All right. So I'm going to ask you to lay down and I'm going to take a look at your tummy.
Okay.
Okay, Mary Rose, are you comfortable?
Yes.
Okay. Is it okay if I raise your top a little bit and unbutton your pants? Okay. Go ahead and just relax. And I'll begin by doing a visual inspection of the abdominal area. I'm also going to check your chest and your neck, as well as your shoulders. The face, arms. Okay. I'm gonna go ahead and auscultate the abdomen. I'm paying attention to any swooshing sounds. I'm hearing activity consistent with normal digestion and no extra sounds, no gurgling or swooshing sounds. Okay, good. I'm also going to check for the presence of any bruit on the carotid artery. No bruit present. Okay. Let's see, do you feel me touching your belly button?
A little bit.
Okay. How about now?
Yes.
All right. Just going to inspect the belly button area. I'm gonna need to bring in extra light. Okay. And no discharge, no redness, no signs of any inflammation. Do you feel any pain here?
No.
Okay, good. I'm going to do a light palpation and check the sizes and shapes of your internal organs and also see if I can detect any masses. So go ahead and just breathe normally. Okay. Checking the size of the liver, and the tip of the liver is barely palpable, which is good. Not enlarged, normal size and shape. Okay. All right, I'm going to do a light percussion and check for the type of resonance that I'm hearing from your internal cavity. Okay, that's good. Good. I'm looking for dull, very bass sounds. Good. Good. I'm gonna do the same on your chest. Good. All right. I'm gonna take a couple of measurements. And across we have 37 centimeters from the belly button to the top here of your clavicle 38 and to the shoulder. Okay, 46, exactly 46. Good. So normal symmetry, the proportions are respected. Okay, let's do a quick sensation test, and I want you to tell me if you feel a cold feeling on the right side of your abdomen or the left side.
Okay. Right.
Good.
Left.
Good.
Right.
So that was quite a strong feeling of coldness. Let's try something much more subtle than that.
Right.
Good.
Left. Right. Left.
Okay. And how about this?
Right. Left.
Okay. Very good. And let's try a hot sensation as well.
Right. Left. Right.
Good. And now left or right shoulder.
Right.
Good.
Left.
Good. Okay, so I'm not concerned with the dermatomes in your abdomen, not noting any masses, normal internal sound activity. I'm gonna focus on your face next.
Okay.
And continue checking the cranial nerves. All right, let's start with the eyes. And I want you to just look up for me. Okay. Good. Good. So pupils are round and reactive to light. Can you continue looking up for me? I'm going to take a look at the conjunctiva. Good, pink and moist. Good, pink, and the sclera is white. The arteries look healthy. Gonna go ahead and check the back of your eye as well. Can continue looking up. Perfect. Optic disc looks intact. Retina does not present any lesions. Good. Optic disc is intact on your right eye as well. Okay. I'm going to just palpate your sinuses and your face and your lymph nodes. Have you noticed any lumps or anything concerning your body?
No.
Good. So I will start with the frontal sinuses. Good. Checking for any indentations, any lumps. Any congestion. Okay, good. Any pain there?
No.
Any pain there?
No.
Can you open your mouth slightly? Slightly? Yeah, perfect. I'm gonna tap on your jaw. Okay, any pain?
No.
Okay, I'm gonna press down on your mastoid bone process behind the ear. Okay, good. And checking your head. Looking at the back, at the top of the cervical spine, I'm feeling for any lumps, bumps, and any pain. Good. The head is symmetric and no indentations. Okay. Can you move your head towards your right side? I'm going to take a look at the cervical lymph nodes here. Checking for any swollen lymph nodes. Good, then over on the other side. Good, no lymph nodes enlargement noted here either. And can you shrug up for me? Perfect. All right. So let me take a look inside your ears as well. And then we'll do a hearing test to make sure that the cranial nerves that control your hearing are intact. You can continue looking towards your right side. I'm gonna just take a peek inside the ear canal. Okay, good. Bony landmarks are present. I see the tympanic membrane, pearly gray, no discharge. Good. And over on this side. This ear canal is a little bit more narrow. Okay. All right, same observations. A little bit more wax buildup here, but in the normal amount. Good. So no concerns with the physiological state of your ears. Let's go ahead and do a couple of hearing tests. Keep your eyes closed and tell me if you hear a sound with your left or your right ear, okay? Let me get my device. All right.
Left.
Good.
Right.
Now can you point towards the sound? Good. 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 Perfect. All right, then let's try something a little more subtle. Can you tell me if the sound moves towards you or away from you?
Towards.
Okay. And how about now?
Away.
Perfect. All right. And let's check the dermatomes of your face as well. I have a hot and a cold object. You can just say hot or cold.
Hot.
Good.
Cold.
Very good.
Cold.
Good.
Hot.
All right. Good. And now I'm going to put some slight pressure on the bony prominences of your face and chest. And I want you to point to where you feel me touching you. Good. 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 Very good. Okay, so let's go ahead and check your legs and your feet as well. All right, Mary Rose, let's take a look at your legs here. And okay. All right. So I'll be doing a visual inspection first. Capillary refills within 2 seconds, which is normal. Checking for any edema signs, any water retention that's above normal. Ooh, your feet are quite cold. Is that normal for you?
Yeah, usually they get cold.
I can feel the coldness through the gloves. Okay. Can you tell me where I'm touching you?
My big toe.
Okay, left or right?
Right.
How about now?
Other foot left.
Okay. And how about now? Where am I touching you?
Right heel.
Okay, now?
Left heel.
Perfect. All right, I'm gonna check your pedal pulses. 2.5 and synchronized. Good. All right. Gonna check for any abnormal neurological reactions upon tapping. Good. Okay. I'm also going to check your popliteal pulse by the knee. Okay, good. And I'm gonna check the nails for any pitting or clubbing symptoms that may indicate hypothyroidism and genetic conditions that are abnormal. Okay, no signs of any clubbing or pitting. That's great. Okay. All right. Can you push into my palms with the top of your... Good. And now with the knees as well, can you push into my palms? Perfect. All right. Okay, Let's do a couple of neurological tests. Okay, I'm going to touch you with an object and I want you to tell me when you stop feeling the sensation.
Stopped.
Good.
Stopped.
Good.
Stopped. Stopped.
Good. Okay, I'm going to touch you with something sharp and I want you to say yes when you feel it.
Yes. 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 Yes.
Good. All right. And I'm going to touch you with something soft and I want you to tell me if you feel the sensation on your left leg or your right leg.
Okay. Left.
Good.
Right. Left. Right.
Good. Okay, I'm going to take a couple of measurements. 6.5, 6, and I'm going to check your ankle for any inflammation. We are at 8 here. And we're exactly at 8. Okay, so no inflammation of the ankles, no water retention, nothing abnormal. And I want you to flip face down so I can do the Babinski test on the bottom of your foot. Okay, it's good.
Kick the microphone.
Okay. Do you feel me touching your calves? Okay, good. And do you feel this?
Yes.
And this?
Yes.
Good. All right, let's do the Babinski test. And perfect. Perfect. Okay. So Babinski is negative, no neurological signs of anything abnormal. And not seeing any signs of edema on your calves. Plantar region looks normal. Can you wiggle your toes for me? Good. All right. You can come back up now. Okay, Mary Rose, I did a very thorough investigation. I took a look at your abdomen, the cranial nerves. I checked your eyes, ears, and your feet and your legs. I'm going to take a couple of notes of the fact that there were no positive neurological findings. So everything checks out. The cranial nerves are intact and Babinski test was negative. The abdomen did not present a loss of sensitivity in the dermatites. Okay. So let's monitor that loss of sensation that you said that you feel. And let's come back in a couple of weeks and see where we are.
Okay.
Do you have any questions for me?
I don't think so, no.
All right. Great seeing you today.
Good seeing you too.